Hi, my name is Jessica Thompson, and I will be presenting HIV among MSM, men who have sex with men living in Philadelphia, and their continuum of care. Essentially what these cases, what their relationship is to their linkage of care. As you can see in Figure 1, it shows the percentage of people with new diagnosis who were linked to care, percentage of people who were retained in care, and the percentage of people who were virally suppressed based on all persons living with HIV. And it compares it to the whole country. So the green is Philadelphia and the blue is the United States. Linkage to care right away for newly HIV cases is extremely important to both the individual with HIV and reducing the spread of HIV. The rate of new HIV diagnosis is higher among MSM when compared to other high-risk groups. And then here's the relationship between the stakeholders and the healthcare issue. So we have under policy, Pennsylvania Health Department and AIDS Fund. Under counseling and testing is the Philadelphia AIDS Consortium, TPAC, and the Action AIDS. Under outreach is NHBS and Philadelphia Fight. Under surveillance is the Philadelphia Health Department and Health Center 1. Under prevention would be Colors and GALA. And here we have how all of these components are, and the stakeholders are connected to these components. So I'll start over with surveillance. Going over right into policy, turning data into knowledge, and then surveillance data turns into program implementation as well, going towards prevention. Surveillance is the first step, which is why I started there. And then going right over to outreach. So HIV health promotion goes towards counseling and testing, and then gaining that support goes right to policy, and then policy goes to back to prevention. Laws reducing transmission goes towards prevention of HIV, and then back over here, counseling and testing. That's how we collect and the lab data going towards surveillance, and then it kind of goes back to policy, back to prevention. Counseling and testing also goes towards program support, which leads to prevention. And then over here is the target population, MSN, which they would be primarily focused on counseling and testing, and they would be primarily in surveillance as well. And that's it for that slide. Now we have the infographic that I've created, and so the description of this infographic. So stressing the need for people to get into care and stay in care when they are diagnosed with HIV is a big part of the message in this infographic. So right over here you see, did you know not everyone who has HIV in Philadelphia is getting the care they need to stay virally suppressed and healthy. And then over here explains what HIV is. HIV is a virus that attacks your body's immune system. So, as I was saying over here, HIV is a virus that attacks cells of your body's immune system. For people who are unfamiliar with the disease. And then it also lets people know of the problem. So not everyone's getting the care. And then over here is the bar chart that represents a visual to understand really the difference in percentages of people linked to care and retained in care and who are staying virally suppressed. So as you can see, here is a big gap, linkage to care between people who are linked to care right away and then new diagnosis, and then retained in care, so people who are staying in care, 46% compared to 87% is kind kind of a big gap there. And then staying virally suppressed, 51%. And then over here, like next steps, getting tested, getting to care, stay healthy. Just a message on the infographic to share with the public, steps to take to stay healthy. And then a conclusion over here in the corner, people need to stay in care to stop the spread of HIV, which is really important to preventing HIV, is people staying in care and staying virally suppressed. And then here we have ideas for future programs. So more research should be done on strategies that successfully engage MSM in care. Engagement in care is essential for MSM individuals to stay in care after getting linked to care. And then when stakeholders are developing future programs, they should also focus on the relatedness of social and cultural factors that potentially influence engagement in care among MSM. Future programs should focus on promotion of self-efficacy as well in MSM individuals. Self-efficacy is essential in some MSM individual for their process, for their self-acceptance in their sexual identity. It was found, that the difficulty with self-acceptance or disclosure may affect willingness to engage in care. And then including linkage to other care services might also help HIV programs such as care for MSM who engage in substance abuse. So linking these people into substance abuse care as well as HIV care can help reduce transmission of HIV. And then here are my references. And that's the end. Thank you.